Chilling moment on the Hill now when even Kathleen Sebelius could not give a straight answer on how many Americans have enrolled and actually have insurance.
Would you define enrollment? Define what you mean by enrollment.
We are giving you the numbers of individuals who have chosen a plan.
But not actually paid their first
That's
premium
correct.
or received
Through the end of November, yes. Payment isn't due, as you know, sir, until mid-December in order to be fully covered. So we don't have those numbers, and I think most Americans probably will not pay until their money is owed.
So you can't guarantee the actual number of constituents who have coverage that they...
Not until they pay their premium.
The congressman doing the questions is Joe Pitts, Republican out of Pennsylvania, chair of the House Health Subcommittee. Sir, good morning to you.
Good morning.
What did you learn from that?
Well, I learned that the secretary is less than forthright. They're losing credibility every day. They wouldn't admit how many cancellations there were. They wouldn't tell us how many were actually enrolled. They won't admit that this is harming the American public. They don't admit their broken promises. So, unfortunately, they're not trustworthy. They're not being candid with information they have.
Why would that be? Well, and let me phrase it a different way. Do you think they have the information, they're just not coming forward with it because it would be embarrassing to the program so far? Or do they possibly just not know, sir?
I think they have a lot more information than they're giving us. That has been the case in the past. And so we're just going to have to wait, and once we get the information, then perhaps call the secretary back and review what she said last time and try to get more information in the future, because this is a rolling disaster.
If that is the case, what do you think that lack of information reveals, whether publicly or privately?
It reveals that not only was the website broken, this is a broken law. There are a series of problems that are just waiting to happen. The next big one is the gap in coverage. People who think they're covered, who on January 1st, when they go to their doctor, are going to find out they're not covered. And that's going to create real panic. So we're just going to stay...
Let me ask you about that. Do you have a number or an approximation for the number of people who may be a victim of that scenario in January?
No.